everyone, this is Dr. Anusha, specialist in internal medicine. So today let us see what's the most common non-communicable disease that we come across in India. So yes, that you all know, it's diabetes. So we have almost 100 million population in India who have diabetes, and yes, equal number of people having pre-diabetes as well. So what do you need to know when somebody is having diabetes, or how do you predict somebody is having diabetes? So what symptoms do you see? One is frequency of urination. That means the number of times you have to go for urination, especially in the night, increases. And the amount of water that you've been taking all of a sudden increases, which you were taking initially 2-3 liters might go up to 4-5 liters all of a sudden. You feel hungry very frequently. That is one most important thing. And apart from that, yes, unexplained fatigue and feeling giddy without any other reasons, or you're feeling a lot of body pains where you've not done anything too much, or you've not worked out but still feeling tired. These are the common symptoms that we come across. What do you need to do when you're having these common symptoms? You'll have to at least take a random blood sugar test if you're already having any patients who are any family members who have diabetes at home. You can just check your sugars at home as well, a random sugars. If it is more than 200, you will definitely have to visit your physician nearby and then plan your treatment accordingly. This becomes very important if you're having a genetic history. Your siblings, your parents, or any of your nearest cousins are having diabetes. That means you have a strong genetic predisposition. That time, any lifestyle hit. So that means if your lifestyle is not good, you're not moving about well, you're having a bad diet, all of these things gives you a second hit there. So there you need to visit your physician and see whether you are prone to diabetes and all of that. What does your doctor do when they are diagnosed to be diabetes? Yes, first thing definitely everybody will tell you is your lifestyle changes, which is equally important or probably more important than your medicines. And then we go about with medicines. It depends on the patient's blood sugars, patient's compliance, whether the oral medicines are required or insulin, or whether we have once weekly injections as well, which are equally good results compared to your insulin. So it becomes very important for you to visit your nearest physician, see whether you are at risk of developing diabetes, especially if you're having a genetic history. This becomes very important, and please be very vigilant in getting yourself diagnosed or evaluated for this risk, because if undiagnosed for long term or if not treated adequately, there are complications that can occur with this. You might think it is just sugars, what is there in that, but you have a lot of complications that can occur. Like, you will be very prone to infections, you will have issues with your memory, disturbances can happen, you can have issues with your nerves. That means your nerves are not picking up well the pain, touch, pressure. So we call it as neuropathy. So this can come in form of having numbness in your feet and palms. You can have burning sensation, all of this. Long term, you can have issues with your kidneys not functioning well, having a reduced urine output. You can put a lot of pressure on your heart. You can affect your livers. So it's not just a blood sugar control, but it's affecting your whole organ system in your body. So please get yourself diagnosed, treated with either lifestyle or medicines as early as possible if you're having any of the symptoms that I had spoken early, and make sure that the prevalence or the incidence of diabetes and pre-diabetes comes down in our local community. Thank you.